Hey, this is William Tincup and Ryan Leary. You are listening and watching the Use Case Podcast. Today we have Jeff on from Aptia, and we're going to be learning all about his company and a little bit about Jeff as well. So, Jeff, how you doing today?
I'm great. How about you guys?
You are great.
Oh,
Done.
Oh,
fantastic.
look at that. We're off to a
See,
flying start.
you are great. And you're in Boston, is that
I
right?
am indeed, yes.
Ah, very
See,
nice.
there's nothing, there's always, you can always tell when you like somebody based on their clothing. And the fact that Jeff is in Boston wearing Eagles green or close enough to Eagles green tells me he's a good guy.
Now, Ryan, up here they would call it Celtics green, but we
That's
may be
exactly
splitting
Ah,
hairs
is that what that is?
It is.
a little bit, but
Yeah. It seems
fly
that they
will
want.
fly, my
Yeah,
friend.
yeah.
It
Yeah,
seems
we'll
that they
go with
just
Eagles green.
well, seems that they just won a championship. I would go with Celtics green.
There you go.
You know,
Yeah.
the sad part is I didn't even think about the Celtics. I
No, of
just
course you
thought
didn't.
Patriots. That's all I thought.
Yeah, if you're in Philly, though, I think that's kind of the deal, right? You can't think
Yeah.
in Boston terms at all, right?
No.
Yeah.
No,
No.
it's
I
an
get that.
area.
No.
Yeah.
It's a cluster.
Yeah.
Hey, guys,
Jersey,
I come
New
in
York,
peace.
none of that.
I'm living in Boston, but I come in peace, I swear.
Sorry, he's a Cowboys fan, so
You're good.
we
You're
can
good.
team up on him that way.
We haven't been relevant in 30 years. We're good. No worries.
35.
There's tell us,
Nice.
just tell us
Do you
tell us
guys
a
need
little
a
bit.
moment alone?
No, it seems like it. We're gonna go off camera for a moment. Tell us a little bit about yourself, and tell us once we do that, tell us about Aptia.
All right.
Apta.
Got it.
We'll edit
we'll
that.
train you. Don't worry. We got some time
This is
together. We'll get
Dallas
that.
talking.
So, husband, father, Canadian by birth, American by upbringing. I've been in the tech-enabled services businesses my whole career. Had a major in tech and telecom for the first half, and in the second half, I've been in the HCM, human capital management, benefit administration, and payroll businesses. Been an executive at companies like ADP and Paychex, Aon, and now running Aptia here in the United States.
That's fantastic. We know all those companies.
Yeah.
Were you when you were your time at ADP? Did you crisscross with employees, the technology?
For sure, yeah. When I was at ADP, I was running the Canadian operation, so
Oh wow. Okay.
had a lot of exposure to that for sure.
Okay. Yeah, that was cool tech at the time. I mean, things have changed clearly, but at the time, that was really cool tech.
Well, why don't we learn a little bit about Aptia? Tell us what is Aptia, what are you guys doing, what problem you solving, and we'll go from there.
Sure. The company really has, I guess, three primary constituents. We go to market through brokers. So think of it as
Right.
broker-led sale in the health administration space. So, they're doing a lot to advise clients, and we normally sell to clients that have more than 1,000 employees. And a lot of those are taking advice from their broker on who they
Right.
should use for their benefit
Right.
administration. So they're a big channel of ours. And then our clients are the employers. So they purchase the benefit administration services from us. And then we service their employees. So the problem we're solving is you've got these large employers who have to either buy technology, stand up processes, acquire talent, and figure out ways to service their populations, or they can pull in someone like an Aptia that allows them to kind of offload all of that, let them focus on their core business and not have to acquire these skills, stay compliant, stay up to date with tech, all that sort of stuff. So, it's one of those classic examples where if it's critically important to everybody and strategic to nobody, it's a perfect candidate for outsourcing. So we're that outsourcer that does this in the benefit administration space.
So with benefits now, are you seeing, is it just health benefits, or do you get into financial or well-being or wellness and stuff like that?
Yeah, so we're primarily a health administration provider, so that is the focus of our business. The very nature of it, though, is you end up touching a lot of the other benefits that exist in the ecosystem. But absolutely, we're a pure play health and benefit administrator for
Right.
active employee populations, as well as we can do that for companies who want to offer those benefits to their retirees.
Oh, that's cool.
Yeah.
That's I haven't heard that before. So that's very, very cool.
Yeah,
Any
that market's changed a lot over the years. It used to be that every employer of any significant size offered,
right,
hire to grave sort of benefit packages. Now what we see is there's less employers doing that, and those employers that do it usually do it as a subsidy rather than being in the kind of retiree health business themselves.
right. And it's multiple health benefits plans. Like the brokers can go with, we'll just use some names, Aetna versus United Healthcare versus Blue Shield or Blue Cross or whatever. So they can help their client pick the best plan, and then the administration of that, open enrollment, and all the things that kind of go with that. That's through you.
You got it. The broker's going to help them pick the carrier. They're going to
Right.
help them figure out the cost of coverage. They're going to do all of that strategery.
Yep.
And then
Yeah.
we'll come in behind that and make sure all of that stuff works for the broker and for the client. And, we'll do the eligibility management of the employees. We'll do the enrollment on the platform.
Right.
We'll manage life events as their needs change throughout the year. We're there for all that.
Oh, that's
Yeah.
cool.
A lot of we do a lot of different shows and have different conversations, and a lot of the topics have been around compliance and staying up to date with all of this stuff. So obviously, if someone who's listening is at the right company, 1,000, 5,000, 10,000, 100,000 plus person, they understand the value here. But maybe talk a little bit about where Aptia comes in on managing all of that and taking care of all of the compliance and making sure everybody is on the up and up.
Yeah, it's a great question, and the in my time in the industry over the last, call it, decade and a half, I've just seen a real ratcheting up of this complexity.
Mm,
There's just I'd say one root cause of that is there's been a lack of will at the federal level. So you're
right,
seeing all that complexity get layered in at the state level, and
Right.
even increasingly at the
mm,
city level. There's some cities that have been really assertive relative
right,
to what the entitlements are of their populations. So we're going to take that off of the plate of the employer to worry about. We're going to make sure that our systems are compliant. We're going to make sure that their programs are going to be compliant. And frankly, we're going to help them determine the right eligibility for who should be on the program and who
right,
should not be. So back to the point around outsourcing, like, why would an employer want to have to figure that stuff out on their own? They can rely on the expertise we have and the benefits of,
yeah.
hundreds or thousands of customers coming together with a supplier like ours, and we'll take those problems away for that client.
Yeah, it's a good argument of why would you have Dan or Susie try to remain compliant and understand what's going on as
Yeah.
opposed to somebody that's doing it every single day. A technology that already understands the compliance, understands the complexity, might even be see some of the compliance things that are coming down the pike and get in front of it as opposed to someone. I mean, that would be, it's like payroll or
It's
similar to
exactly
payroll.
like payroll. Imagine,
Hmm.
Right.
standing up. If you had four locations, one in New York, one in California, one in Florida, one in Texas, like
Oof.
Right.
where do you even start, right? You
Oh,
gotta.
Yeah.
There's just such different
It's all different.
regulations in all those places.
yeah.
Yeah.
I would start in California because it's most complex.
Exactly.
But
Exactly.
Where have you seen this shift in complexity? So you've been doing this
Yeah.
decade and a half, you said. So from the time you came in till now, what does that look like? Where was it when you started versus now? I'm curious to see what your take is there.
Yeah, I'd say really, Ryan, it's become very bespoke by state. So
right,
it
Mm,
used to be you could rely on pretty concrete direction
right.
of where legislation was, and there was
right.
more uniformity, and the U.S.
Yeah.
looked like a much more homogenous market. I would say the states, again, due to just the gridlock at the federal level, have decided to intervene and do much, much more on their own. And that's where we see it play through increasingly. It is really that state regulation. No, I would say no entity at the public level has gotten less complex in
Right.
the last decade and a
100%.
half. It's
100%.
just the degree to which they've layered on this
But
complexity.
to me, it's like what we used to see in global payroll is what we're now seeing in global benefits. And the thing is again, Texas, as you already said, Texas versus California, they're like two countries. They're like two different countries. There's France and Germany. There's no difference.
Well, and so here's another piece of that as well from a provider like ours. So we've seen a proliferation of benefit types. So,
Right.
The big three are your health benefits, your retirement or wealth benefits, and your time off. Like those are kind of the three core things that have kind of traveled through the passage of time. And the pretty standard supplemental stuff, dental, vision,
Right.
that stuff is all pretty standard as well. But the stuff beyond that, you look at Gen Z, right? The second most popular benefit for our Gen Z population is pet insurance, just as an example. So we're seeing this proliferation.
Oh man, you just hit on a nerve.
Ryan and I
I
did
didn't
SHRM.
mean to, Ryan.
No. This is greatness. So we were at SHRM.
Oh,
It
this
was
is
in New
better than the
Orleans.
Celtics.
This is probably 5 years ago. And we were doing shows out in front of their expo.
Yeah.
And we had, I can't remember the carrier, but it was a pet.
The very
It was-
first episode. Oh god.
Yeah. And I said, Whistle, we're going to be talking about pet insurance. And Ryan's head almost exploded.
It's like,
I'm like,
what
dude,
the-
it's a thing.
How am I going to talk about pet insurance?
It's a thing. It's important to people. And now we're starting to see even further into that is bereavement policies around pets. Pet bereavement policies and things like that. So
now I got to ask questions. So do you have a pet, Ryan?
I do, but I just never. He
doesn't
gets
love his
sick. I take
pets.
him to the vet.
Is it a dog?
Yeah.
he doesn't care.
So you're staring down a $5,000 bill for the dog. You're going to get the surgery, right?
Well,
Have to
right.
get the surgery.
So
He's got
All
three girls.
I fully understand.
And a wife.
So this is where this is so awful. This is where I change. This
He
is
hates
where
his
I
pets.
change my thought process. When we take the dog to boarding, when we travel,
Yeah.
they have the little box that says, "How much would you like to spend should your pet need surgery or?"
That's actually really genius.
Right, and it's like, and they don't even give you
ta-
a box to check. You have to write a number. So as I'm writing the number,
tapping
like,
out.
well, is 500 1,000? Like, is it like how much am I
Dude,
willing to spend?
Dude,
And I
you're so
feel bad
torched.
for like an hour.
No, you're so
I think
torched because
it's a compassion quiz. It really is, right?
It is.
Yeah.
It
yeah.
My
really
father,
is.
one of his jobs outside. He was in the late 50s, early 60s. So this would be the early 60s. He went and worked for a vet, and it was a bit back then. It was a bit on how much money did I have. How much
Right.
money how important is this pet to them, right?
Yeah, yeah.
And
It's
so
really.
He was really jaded. My dad was really jaded with that stuff. So
Yeah.
I got a little of that, and I have two pits. I have two pit bulls, and they're almost indestructible. Like these dogs have eaten a remote control. They've eaten an entire bottle of ibuprofen. They've eaten batteries. Like I'm not really like we're not going to have to. There won't be
Yeah.
a big
You have
discussion
pet
at the
insurance?
pet. No, we're good. No,
Hey, I'm just thinking, guys. Do you remember a thing called radio? Like, if this was a live show, think about it. Our lines would be burning.
Oh
up.
my
People
God,
calling
the
in,
vines would
right?
be lit up. You
people-
animal haters.
cat people alone. The SPCA
Yeah.
would be involved. No, this is.
Yeah, I'm feeling a little judged right now.
I'm really sorry.
You
I
should.
thought of pet insurance, guys.
Oh yeah.
Oh,
But
it's just.
but it's
and then we had a story this week. It was on pet
pet
bereavement.
bereavement.
People
Yeah.
having the benefit of taking time off because your pet has passed.
Oh,
But
Ryan, and
what determines a
again,
pet? Is it cat, dog, or is it a gerbil and fish?
his
Yeah,
his head
it's-
almost exploded when I brought the story to him because he's like, "Really? You're going to take off?" of work because your goldfish died? I'm like, dude, it's usually probably not goldfish. It's probably a pet that they've had for a long time, and
Wow.
it's a thing.
Yeah.
Hey,
Oh, I would
a lot
be.
of
I'm gonna bring you two back to earth here for a second. Is what I'm gonna do. But what you guys are bringing up, it speaks to the way things have changed, right? 10 years
yes,
ago,
Yeah.
nobody was having
no,
this conversation, and now
No.
we've got things like, we've got things like weight loss benefits, we've got
right,
things like
Right.
legal benefits,
right,
we've got things like menopausal benefits. We've
yep,
got all this
Right.
array
fertility
of
treatments,
choice out there. Like I
fertility,
think SHRM, who's the Society for Human Resource Management, I just saw their study in this area, and there's like 216 things they're tracking that
oh
are
yeah,
employee benefits. And when you think about kind of your average worker, right? Half of the American workforce is going to wrestle to come up with $500 in an emergency, and you're giving them
Sure.
health, you're giving them 401k match, you're
right,
giving them time off, you're asking them to choose between vision and dental and student loan repayment and tuition assistance. Like you've got this vast
oh
array of
yeah,
choices. So I think another macro trend is in all of our complexity, are we really making the employment condition better for our employees?
should
And are
be,
we making the right choices for what they actually want and need? And we
it's
can
Right.
really help employers do
well,
some of
Jeff.
that.
I've done this bit for years around user adoption of software, HR software in particular, and I start off by saying, listen, software companies will have you believe that they have a lot of benefits, the features that they have, etc. But a benefit isn't a benefit unless you use it. Then it crosses over into becoming an actual benefit. Before that, it's an option,
Right.
it's a feature, it's something that's there, but it's not a benefit until you consume it. So consumption, usage, adoption, etc. But I had a very specific question for you
Yeah, go.
around GLP-1s. So I've been tracking this because of all the medicines, but I've been tracking it from the insurance carrier perspective on what they're willing to fund and not fund as it relates to GLP-1. So do you have any insight? Do you see anything there?
I I see. I'm guessing I'm seeing the same thing that you're seeing, which is
Yeah.
a lot of indecision,
Yes.
a tsunami level trend coming at them,
Oh yeah.
an expensive product,
Hmm.
one that seen maybe as a panacea
Yep.
for problems.
Yep.
And I don't. I'd like to tell you I see a concrete direction on it. I don't yet. I see a lot of people hovering and looking for
Yeah.
signals from the market on which way to go
Navel
on it,
gazing.
but
Yeah.
we're not there yet, in my opinion, based on what I'm
Yeah.
seeing.
I've got the same take. I think it's if done well, it could be marketed as a retention and a recruiting tool. If done well, it's like, no, we're gonna make the bet that you want Ozempic or any of the folks that fall
Yeah,
into the category.
yeah.
And you know what? Hey, cool, no judgment. Here's the deal. We got it covered. We got you covered. Now, if it's marketed well to the employee base, why would I leave? If it's marketed well to candidates, if and it's a coin flip of a job, I'm taking a job.
So here's something that is an adjunct to that for me is who's your population and what
Yeah,
is the experience of your
good
population
point.
and what's going to
Good
matter
point.
to that population.
Right.
This in some companies may absolutely be worth it. You may be able to draw a straight line to the ROI of
Right,
offering
right,
that.
right,
Hmm.
right.
Whereas I'll bring up the menopausal one again. It's 10% of the workforce are menopausal age women. And you may be much better off to offer menopausal leave or menopausal support as
Right,
depending
right.
on who you are as a company, what you believe in, and
Yeah.
what your population wants and needs.
So it's understanding that your employee population is shifting. And so
Yes.
surveying them, figuring out what's important to them, making sure that you're
Yeah.
not giving them stuff that's great, it's cool, but it's not stuff that they're going to consume or use.
Yeah,
Yeah.
and if I may, it's I guess no newsflash here, 5 generations in the workforce.
Yeah,
So what do you do
Hmm.
about that? How do you play through all that? Maybe being really great at the core three, right? I have
right,
great health benefits, I have
right,
great retirement benefits, and I have a competitive leave program.
Right.
because those things appeal to everybody,
Yeah.
usually.
And then so then the next level to that, how does an employer decide what are
Oof.
the extra benefits? And I have my view of it. I feel like there's just three people sitting in a room and they're saying, well, these look really good. And they're choosing off of a menu, right? A, B, and C. Let's
Well,
go. Then they,
first of all, they're brokers helping them through some of
well,
this.
sure. Yeah, yeah. But I
Okay.
mean, does an organization, or do you see, I should say, not does, are you seeing
Yeah.
organizations at the highest levels that have programs where employees actually appreciate it and it's known that they have a really good program that they offer? How are they doing this? Are they surveying the employee population? Are they taking that, or are they just making decisions based off what brokers are seeing across competitors and things like that? Because this is a recruiting tool. This is absolutely a
It
Can
recruiting
is.
be.
tool.
It
Can be.
is.
Yeah.
One thing I'd say probably in the both the employer and broker's defenses, and I've sat across hundreds of clients wrestling with these
Oh
decisions,
yeah.
and
Can't have it all.
and
Can't have it all.
they can't have it all, but invariably their hearts are in the right place.
Right.
With whatever
Right.
Yeah.
budget they have, they want to do the best possible thing they can for their
Right.
employees. Like I do see a genuineness of spirit on these decisions that may not be
Yeah.
obvious to anyone. Now, are they restricted on budgets? Have they got scarcity issues? For sure,
Sure.
but they're trying to do the best they can. What the broker's role in that is to guide them through that scarcity. So here's an
Right.
example of a trade-off. A trade-off might be, man, like our core health, based on our experience last year, those premiums are going to go up 7 or 8%. And there's like nothing in your benefit portfolio that's going to cost you as much as that.
Right.
So if I want to keep my employee contributions level, I might have to forsake some things at the edge, which are nice and interesting, dare I say pet insurance or whatever it is.
Mm-hmm.
Maybe I'm going to give up on that to keep core health stable. I think the more enlightened employers are doing a lot to understand the correlation between benefit consumption and employee retention. I
Right.
think the more enlightened ones are trying to figure out the connection between benefit consumption and employee performance.
Right.
But at the very heart, I think all of them are trying to balance this. What's the best mix? Here's one quick example of something on this tangent. So there's one of the wellness apps that we had at a former employer of mine, and they came in after we had them for a year, and they could draw a straight line. We had three populations. There was the population that didn't open the thing ever. There was the population that opened it, signed up, maybe did a quiz and got out of
Mm-hmm.
there. And then there was the population that opened it, used it, were religious about it. And guess what the health experience was of those three different populations? So their pitch to us was, you need to go all in on this app because it is much better and your people are much healthier if they engage in that. Now, what's causation? What's
Yeah.
coincidence?
Yeah. Yeah.
What's
Yeah.
correlation? I'm not sure. But it's an example of what we see all the time on these trade offs of employers want to offer benefits that are relevant. Sometimes we do see a spray and pray approach of I'm going to offer a bunch of stuff and see what
Right.
see what.
What's the importance of communications in this process?
Mm,
Because if we're surveying the audience, i.e., the employee population, we have an idea, but we got to make that tough trade-off of okay, the rates. I'm pretty sure insurance rates at least in my history, I don't think they've ever gone down. I might be wrong about.
they might have been flat. I doubt they ever
Okay,
went down.
Yeah.
flat is the new down.
Flat's the
Got
new
it.
down.
Okay, so, but they might not understand. Listen, you have an 80% contribution, or if you have a 100% contribution from the company, um, we can take that down to 80. Here's how that impacts you, and we can have these other things, or we can keep it at 100%. I'm just using basic numbers, but we're going to have to get rid of some of the other stuff. Like that's to me, that's a comms related, issue where they're once the decisions have been made and the hard decisions have been made, somebody's got to communicate this down to the employees so they understand what's changing and they don't wake up in a new
Yeah.
year or
And
if
it's
they
not just
do
an email.
right. No,
Right.
no.
Yes, and communications and benefit programs go so closely together because it's complicated.
Yep.
and it's hard, and people want to know what the changes are. You asked earlier, Ryan, about asking. Do you ask your employees about what they want? Do it, but only if you're going to listen. If you're going to
True.
take the approach of we're sure that's
100%.
great, they want this, but we're going to do that.
Right.
Um,
Yeah.
you
That just
know,
creates frustration.
it
Yeah, I
does.
mean,
But
I've, yeah, it's interesting you say that, Jeff, because I've been in rooms and discussions where, again, everybody means well in the room. They
Yeah.
want to make the right decision, but there's always that person that influences the others that says, let's ask. They don't really know what we do. We could just say, this is what the survey said. And that's how we made our decision. There's always that person. And I think that fear, and let's say fear, that's maybe because it's just my jadedness, how the employee population potentially feels that the decisions are being made. You asked me, but you really didn't listen. So I think
Yeah.
you're making a good point there.
Or they asked, they listened, and they didn't make that decision, but they could communicate and close the loop.
Correct.
Like,
or they asked an unsolvable
right.
question. So it
Yeah.
could be, do you want more of this or that? Well, of course I do.
Yeah.
Yeah.
In absence of
Yes.
having to make the trade-off decisions associated
Yeah.
with that,
Can't have
I
either,
want
but
more of
you can.
everything.
Yeah.
I love that. I think there's a bunch of kind of situational and scenario based things that we can teach employees to where they understand that this is a game of trade offs. That's
Yes.
all it
Yeah.
is. That, you can, okay, we can do 100% of your health benefits, the employee, and we can do 100% of your family's health
Right.
benefits.
Yeah.
Right.
If
But
we do that, there's nothing else. There's
right.
literally nothing, retirement, nothing else. So, do you want to make that decision now to somebody that's got kids? Yeah, they probably would make a different decision than somebody that's just entering the workforce that doesn't have kids.
It's funny. One of the things we've done at Aptia, we carved out of Mercer. So we were the benefit
Right,
administration entity inside Mercer, which is a subsidiary of Marsh & McLennan.
right,
And when we carved this company out, one of the promises we made to ourselves and to our employees was that everyone would be a shareholder. And we made that come true last month. We told everybody what shares they were going to get, and now, so what we're trying to do with that is to have employees think that way when
right.
they're helping us with ideas on what to do with problems like this. Your owners, that comes with some rights, but it also comes
Right.
with some responsibilities of
Yep.
helping us trade off what the right things are. And what
Yeah.
I found on this is if you ask, if you respect, if you're transparent, if you're genuine, if you explain your way through it, it usually works out better than if you dress it up in a bunch of corporate gobbledygook around why you can't do this or that or the other thing.
Oh, Ryan, do you have
Go
some?
ahead. No, go ahead.
How often should they? Because at least as I remember it, people either do it on the calendar year or they do it mid-year,
Yeah.
somewhere in that process. So how often should they be looking at usage and consumption so that they understand that? We get away from the asking employees part. Now let's get into, we're looking at the system. You know what they're consuming. This, as a technology, you know what's being consumed and what's not being consumed. How often should they be looking at that? The
Yeah, I
company,
think there's some biorhythms to this industry. I think
right,
it starts, the Super Bowl of this thing is open enrollment. So the
right,
period sometime between, mid October and December 1st, where everybody enrolls. And your benefits get set on January 1st, by and large, and that's the kind of cycle of the business. Then, you've gone live in January. Hopefully, you've gone live smoothly. Nobody's standing at CVS, not being able to get their insulin or any of that
right,
stuff. You've done all
right,
that eligibility and coverage, and that's all working. And then, as an employer, you're debriefing. How'd that enrollment go? What did we learn? What did our employees think of it? So you're doing that kind of in the springtime. Then in the summertime, you're getting into what do we want to do next year? What are our plan design choices? What was our experience last year? How does it influence our cost structure? What do our employees say if we're going to ask them? And then you get into the actual programming and design late in the summer, early in the fall to go with open enrollment again. That's kind of the general nature of the way this industry kind of moves from here.
Yeah.
I didn't ask, but go ahead, Ryan.
No, go ahead. Finish up that, and then cause I might be going backwards a little bit.
No, this is completely different. Did we discuss you're within the four walls of the United States? Are you in Canada or are you global?
We're in the United States.
Yeah. Okay.
Okay.
I did mention the Canadian part. I am
I,
Canadian by
I, I
birth,
I
but
kind
I'm
of
an
feel like that should
American
be
now.
opposite. Most people want to be born in America but raised Canadian,
100%.
Is
I believe in.
is
I
right?
that what
believe
it is?
in. I believe in November. There's going to be an influx.
I love all
So
my countries. I love all
Yeah,
my countries.
love
yeah.
them all.
There may be a whole lot of you may have a whole lot of Americans up your way.
Yeah.
Yeah. Well, you're in Boston, I guess, so that's whatever. All right. So, question I had. This might be going backwards a little bit, but I wanted to
Sure.
ask it because so people who are listening in today to this show, they're going through an issue. Otherwise, they wouldn't be listening to this specific topic, right? It's not something to like I wake up today and I say I want to go talk about administration. So somebody that's in the having trouble now designing a program or understanding what to offer, etc. Consumption models like we were just talking about. What is your recommendation? How do they go about beginning to design or overhauling, I should say, because at that level they've already got something.
Mm,
Overhauling what they already have so that it is better consumed.
I think it probably starts with a frank discussion among the leadership of the entity of who you are and what you want to be to your employees and what degree of investment does that look like.
Mhm.
I think it starts kind of with the culture piece, how you think about your employees, how you value that stuff. Because I think employees recognize when it comes out the other end and you're not being congruent to that. So I
right.
would say start there.
Yeah.
I'd say the next piece is, and you can do that yourself as an employer. There's lots of great broker partners out there. There's good association work, and there's people like us that can get you really grounded in the data. What is happening experientially? How healthy is your population? How well saved is your population? What's your turnover look like? What's your health experience look like? What's your drug consumption look like? Like you got to kind of play with all of that and figure out what's working and what's not,
Right.
and then balance all of that with inflation because you're going to experience some
Mhm.
cost increases from year to year, and 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 partner with your broker and with someone like us to help you ideate and think through those choices. And again, asking employees is a great idea. Listening to some of the best work going on at places like Sherm, to pick one. There's such a wealth of information out there about what direction employers are taking on some of these things. You don't have to be on an island on your own on this stuff. There's lots of readily available
Mhm.
information. I'd say get started early. So if you're thinking about substantive changes, as soon as your enrollment season's over, as soon as you're sure your population's set in January, start investigating what's going on in the market. Get really well informed. Rely on your supply chain to help. That's what we're here for, and we can help you make really really good choices.
Two questions. Take them in any order that you like. One is if you could script buying questions. So for someone that's in the market trying to figure out if you're the right technology platform for them, what should they be asking? And then the second question is your favorite part of the demo. When you get
Mm.
to show people software and you
Mhm.
kind of feel like there's an aha moment, you just kind of can't wait to get to the aha moment. What is that for you?
What
And
is
take
it?
them in any order that you like.
Yeah, it's funny, and I don't know if I'll. First off, it's tough for me to keep two questions straight, but I think in this case, I can actually answer both of them in the same way, and it may not be exactly what you're asking, so we can go at it again if it's not. But we genuinely believe that we're the best service provider in America. We believe that we set a standard in our service levels, in our care for employees, in our responsiveness, in our access to humans, in our net promoter scores, in the
Mhm.
customer satisfaction scores in our call centers. Like we think we're really, really great at that. We're also a pretty new company, And we're also trying to bring that alive at point of sale, which is probably a bit of the challenge for us, right? Because we've been this really well kept secret inside
Right.
Mercer.
Right.
Voila, we're a carve out, we're an independent company. I've got wall to wall green SLAs, and how do I convince clients of that when who is the last company that said, hey, no, we offer pretty crappy service, you should go with someone else? So everybody claims it. I genuinely believe it's true. I mean, if you guys have any advice on that for me on proof sources, I'm all ears for it. But the point of the demo where I get the most excited is when the customer basically understands we have the enrollment and eligibility systems, we've got the decision support tools, we've got the summaries, we've got the navigation pieces, and they want to talk about the difference we can make in the services part of the tech enabled services. Because I think we can all do a pretty good demo, but I think I'll put our people and our capabilities and our service levels up against anybody and be incredibly.
Final question on my side, and I'm going to steal your questions here. But Jeff, what are the questions that potential clients, prospects are not asking that they should be asking?
I think it varies a little bit by segment, Ryan. I would say that I think that clients, what we experience is sometimes it's pretty hard to compare what the cost of ownership is between solutions. I'll give you some examples, right? Like there may be a base charge you're paying per employee per month. Now, does that include administration of Cobra for
Right.
your employees that are
Right.
leaving?
Right.
Does that include spending accounts? Does that include caps on the call center? Does that include enrollment? Does that include communication? I think that it's hard for a client, if they don't have a really strong broker kind of helping them sort this out,
Sorry.
understand what it's really going to cost
Right.
to do this, and then what's included in that bundle. And I'd say the other thing is that, again, in the spirit of proving ourselves, a question I'd like to hear more is put your money where your mouth is on the risk reward relationship. So we'll set a price, but we're willing to take some of those fees at risk. If you're willing to take a bet on us, we'll make a bet on ourselves that we can deliver. So I'd like to hear more discussion on that because I feel like we have unique strength and courage on that we're prepared to
Right.
bring to our clients.
Last thing, we talked size of company, but we didn't, and we've got geography generally, but we didn't
Mhm.
talk about industries. Is there any particular industries that y'all are kind of targeting, or you're going after, or whatever?
I think that we're open for business across all industries. We
Right.
do see the unlike maybe some types of human capital management product lines or other types of services product lines, we see pretty homogeneous buying behavior and use cases across
Right.
industries. Now, a retail environment may have different benefit needs than a professional services environment, but we see the general usage and consumption of that as it faces us to be
Right.
pretty similar.
Love it. Brother, we could talk to you for hours, so thank you for carving out time for us and our audience. Love what you're doing. Absolutely love what you're doing. And thank you again for your time.